St. Mary's College Counseling and Psychological Services, or CAPS for short, is a therapy service provided to all students who need assistance with any serious concerns. This is all in a confidential, safe, and supportive environment. You can access the CAPS website by visiting www.stmarys-ca.edu and clicking the Student Life page. From there, scroll down to the Staying Healthy option, where you can find the CAPS website, and you can set up a counseling appointment to speak to a professional, as well as access to other resources to help with your psychological needs.
So my name's Cynthia Cutshall, and I'm a licensed psychologist and the Associate Director of Clinical Services and Operations at CAPS. And I also serve as the Outreach Coordinator at CAPS.
Should a student start to seek counseling services?
Yeah, that's a really good question. I like to use the headache metaphor. So if you're getting a headache, it's good to take medication before it gets to be full blown. You want to take it early on. So the same thing would apply for therapy. If you notice that you're maybe not doing well, you want to try to start early and reach out for help before you're in too much distress.
Outside of counseling, what are some things that students can do to benefit their mental health?
In terms of what you can do, I always like to start with the basics. So if you can just eat regularly and try to eat well, exercise, make sure you have people in your life who support you, make sure you get enough good sleep. You can also manage stress with yoga or meditation, exercise, being social, really whatever works for you. It kind of depends on the person.
Yeah, definitely.
And I always say everything in moderation. So, for example, exercise is good, but you don't want to exercise too much. If you drink alcohol or use other drugs, you want to use those in moderation. Everything in moderation is a good rule of thumb. And also it can be really helpful to find your sense of purpose and meaning. And identify what you value, what brings you joy and fulfillment. And doing those activities or engaging in those things can really help. And then I think it's also important to remember that not everybody feels happy all the time. That's actually kind of an unrealistic goal. And it's important to find ways to manage difficult emotions. So try not to avoid them, learn to accept them and work through them using some of the strategies that we've just talked about, like the basics, the stress management, the social support, or maybe therapy. And I guess circling back to the point of when should a student seek therapy, you'll probably know that it's time to seek therapy if you notice that there's something in your life that's interfering with your functioning, like it's interfering with your ability to do your schoolwork, or it has a negative impact on your relationships, or if you can't sleep or eat well or feel joy in your life. Those are all signs that maybe it's time to check in with a therapist.
The question is, how do you take culture into account when counseling or making a diagnosis?
I think it's really crucial to consider a person's identities, both in therapy and in assessment. The CAPS staff don't formally diagnose students. That's sort of in keeping with the best practice of most college counseling centers. Yet we're definitely mindful that person's identities shape their experiences and their psychology. And it's really important that therapists know their own identities, how their identities impact their work, and they should educate themselves on identities and cultures that are different from their own. They should practice cultural humility, not make assumptions. And really our goal as therapists is to, or should be, to understand the student as fully as possible. And it's really impossible to do that without considering their identities.
Are there any differences in emotional expression across the cultures of students that have come into the counseling office?
Yeah, so I think that's a great question. Therapy ideally helps students notice and talk about their feelings. And this can be challenging for some people if this wasn't encouraged or modeled in their family of origin. Sometimes this is due to the dynamics of the particular family. Sometimes it can be culturally based. So, for example, some cultures value emotional restraint, and this is contrary to the goals of therapy. Some cultures believe that private matters should be kept within the family and not shared with a stranger. So, yes, there are absolutely familial and cultural differences that impact emotional expression. I think gender identity would be another identity that could impact emotional expression. So, for example, there's a lot of research to show that male identified folks feel less comfortable expressing emotions other than maybe anger or joy. So there's a lot of evidence that one's identities can impact how they express their feelings.
And how has your experience been with the St. Mary's culture as a provider of counseling services?
Yeah. So, I've been here for 11 years since St. Mary's, and noticed some changes over time. I think one thing that I've found to be very heartening is it seems like as a larger society, there's been more flexibility and acceptance around therapy in general. So it does seem like whatever stigma there might be around seeking therapy, it seems to have declined over the time that I've been at St. Mary's. I've also noticed that there's been a lot more flexibility around gender identity and accepting folks from across the range of gender identities and not thinking in terms of binary. That wasn't even really much of a conversation when I first started at St. Mary's in 2009. So there have been some good changes. I think certainly St. Mary's still has work to do, and we can always be more inclusive and learn more and be a better place for all students. So I think there's still work to be done there, and I'm hopeful that will happen.